Hi, my name is Miko Miller, and I am the 30-minute workout specialist. And my goal is to help you maintain or improve your health and quality of life. I believe to be truly healthy, not only do you need to get your 30 minutes in, but you also need to eat a healthy diet as well as take care of your mental health. Now, I like bringing people on to talk about their philosophies of how to become a healthier person, either professionally or personally. And today, I have a very special guest. I have a man that was my college football teammate. He is my fraternity brother. He's my friend, the one and only Quiet Storm, Dr. Kane Onwuzulike.
Hello, everybody. I'm glad to be here. This is a wonderful opportunity for me to not only express some of the values and views I have on being fit, both physically and mentally, as Miko spoke about, but just some philosophies in general that are also applicable to many life settings. Because as we both know, and many of us know, being healthy is just a microcosm of your whole life. And you can apply a lot of these principles to non-physical things per se. So I'm truly excited to be a part of this, session, and would love to share my views with you guys.
Doc, before we get started, I introduced you as Dr. Kane Onwuzulike. Tell us a little bit about yourself. Tell us what part of medicine you do, and tell us a little bit about your fitness background.
Yeah, so I from a very early age was very interested in all kinds of different physical activity, mainly early on with sports. So from tennis to soccer to ultimately football, which became my true passion. I've always been very, very involved in athletics, sports, and subsequently fitness. I'm a first-generation Nigerian. Both my parents are Nigerian, but I was born and raised here in the United States, Detroit, Michigan. Soon moved to Cleveland, where I pursued some academic things. And as Miko introduced you guys, doctor. So I'm a pediatric neurosurgeon. I love what I do. And a lot of these things that we talk about as far as fitness, I also talk with my patients about, because I think it's very important, especially in my field of work. If you're going to undergo a huge procedure, to be frank with you, your fitness has a huge part to do with how you'll come out of that. So oftentimes, before I even have a surgery with the patient, we'll discuss some fitness. We'll look at a couple of parameters to make sure that they are up to par and will potentially have a good outcome. So as mentioned previously, a lot of these things that we're going to discuss are not only applicable immediately as far as how you feel physically, but then also become a part of your daily life and can be extrapolated into other parts of your life, which I think entail total fitness. So that's kind of my view on things. I've tried for a long time to maintain my fitness. As we all do, we struggle. Sometimes we're on top of it. Sometimes we let things go. But what I found is that when I'm best fit mentally is when I'm best fit physically. And it really, really, those two for me go hand in hand. So I found the best times where I'm really dialed in and focused are times where I'm at my best fitness. And for me, it entails a number of different things. I've used free weights. I love to run. I have an animal, so it helps. I can run with my dogs. I love to swim. I think that's a great overall exercise. So I try to do things that are not very monotonous so that I can continue to remain fit and do things that I enjoy doing. And so that's kind of just an overall view of things. We'll probably get into more specific details as we move on with the session today.
That's right, folks. Pediatric neurosurgeon. You heard it right. My dog. All right. I want to talk to you a little bit from your professional point of view as well as your personal point of view. What do you do if I was a patient or a patient going into pre-op? What is your suggestion as far as number of days they should work out? Do you have a preference as to how people should work out? Eating habits. Do you have foods that you think people should eat, or foods that people should stay away from? What is your overall philosophy as far as being a healthier person in those aspects?
That's a great question, and it involves so many different things. So I'll tell you early on. So I think the first part of your question had to do with how I treat or how I deal with my patients as they get prepared for surgery. And it's a big thing, fitness. And again, I'm a pediatric specialist. And so a lot of times I'm dealing with children. usually under the age of 18, mostly a lot of them actually under the age of 15. So they have most of these kids have a fairly high metabolism, and for the most part are not morbidly obese. And usually, unfortunately, when they need my assistance is because they have some kind of ailment which requires surgery. So the first part of it, we put all of our patients through what we call just an initial screen to make sure electrolytes, so these are your basic elements within your body, your sodium, potassium, creatinine, things like that are normal and up to par. Once we do that, we also look at a little bit of things in your blood work, making sure your white blood cells, red blood cells are okay. But then we also look at BMI. BMI is a huge indicator, especially if it's increased rapidly over a couple of months or decreased either way, it could be a huge indicator as to overall fitness. So if I have any kids that are obese, we talk about different ways to deal with that, both from an exercise perspective and then also, as you mentioned, which is equally important, from a dietary aspect. I am not a dietary specialist, and in fact, you'll learn one of the things that I struggle with even to this day is eating healthy. I tend to be more on the fitness side of it, meaning I'll do things to try to keep myself fit physically, but I'm now trying to better incorporate better dietary methods into my, daily regimen. And so that's a huge part that, Miko, you can help all of us with. That's something and many of us struggle with is how can we eat healthy? I think one of the things I've learned through my struggle is it's easier for me to work out than it is for me to eat properly. And so I tend to slide my scale over to being more fit as far as doing things versus how I eat. But I do know, and I've learned very astutely, because my daughter, she's a type 1 diabetic. And when she was diagnosed several years ago, our family went through, and especially myself with her, went through a phase of where we lowered our carbs significantly. And I found for me, and this is not for everybody, but I found for me, carbohydrates were probably the biggest thing for me that added weight to my, to my frame. And so I just saw some amazing results once I started lowering, and not eliminating totally, but lowering my carbohydrate intake along with both anaerobic and aerobic exercise, that my weight dropped immensely in a good way. And I became more toned and more fit. Now, different, elements of our diet have been, attacked over the years, whether it's fat, whether it's carbohydrates, whether it's protein. And so everybody probably has a little different mix of what works for them. But for me, once I made that conscious effort to at least lower or be aware of my carbohydrate intake, combined with some of those other things I was doing, I really, really saw a change in myself. And I'll just share with you guys, I think at the peak, my highest weight I've ever been, and this was probably, I'd say maybe 4 or 5 years ago, I'm about 5'8", but I got up to almost 220 pounds, okay? Now I have a semi-muscular frame, so I quote unquote carried it well, but I knew for me that was a huge weight. That was a weight that for me was probably very, very unhealthy. Long story short, we fast forward to today for a number of reasons, but primarily through what we've discussed, I'm down to, and I probably live around the 170 range, which I'm very comfortable with. I think that's my ideal weight, and it gives me a healthy BMI. So for me, it's been almost a decade's journey of kind of learning your body, learning yourself, learning your dietary habits and what works for you. But together, they're very important, like you alluded to, Miko. So I think it's really important we understand what type of dietary habits we have and how that we can use that to help us get in shape. But then also, too, to vary up. One of the things I'm a huge proponent of is varying your workout regimen so that it does not become too monotonous and you don't get, kind of bogged down with doing the same thing over and over. So for me, again, it's a combination of running. I love to swim. If I picked one exercise that I would do for me, it would be swimming, because I think it pretty much works almost every muscle in your body. You don't necessarily, for all of us that run quite a bit, which many of us do, you don't have the necessarily pounding impact that you do on your muscles and joints from running that you get from swimming. And so I love to do a little bit of both. And then I'll mix that in with some free weights as well, too. And the biggest thing that I think a lot of us, and Miko, you can speak more to this, don't really do as much is stretching and preparing yourself for whatever workout you're going to do. I think here in the Western society, we're pretty big on either free weights or things that are aerobic, but I think a huge part of your workout regimen, a huge part of it should be stretching. And I found that to be very, very beneficial to my overall health and fitness.
Yeah. Yeah, doggy, you came backpedal at 220.
Yeah, right. That's hard to change those hips, isn't it? Yeah.
You know, one of the reasons I asked you to come on is not just your medical expertise, but it's because I know you to be an avid fitness person. You run a lot, you work out now. What are either perceived or things that you went through personally? What are some of the benefits that you noticed when you were at 220 to when you got down to 170? What are some of the health benefits? Sleep better, feel better, more energy. What are
Yeah.
some of the benefits that either you personally experienced or just through your medical profession and medical expertise know people who have experienced? What benefits?
So I'll tell you some immediate physiological ones, okay? The biggest one, quite frankly, just being my overall mental health. As most of us know, when we work out, we feel good. We think we've done something well for ourselves, and that translates oftentimes into mentally feeling better, being able to focus more, being able to do whatever it is your profession or whatever you do, being able to kind of hone in and do that more. I found unequivocally whenever I would wake, because usually for me, my workouts are morning based because that's just when I can get it in. So for me, it usually kickstarted my day. And it's just one of those things where if you know you've got it in before you know you start your work or you start your day, it really just made my day kind of flow a lot smoother because I know I did something beneficial for me. It helped me then to eat better during the day. So I say, hey, I got a good workout in, let's keep this rolling. And so you would eat better, focus better, all of those kind of things. Dropping from a weight of 220 to where I am now, some of the immediate physiological benefits besides the mentation are things that are as serious as blood pressure and cardiovascular fitness, okay? So when you're sitting at a weight that for your frame or your height is not a healthy one, then that also brings in some other unhealthy aspects of life, including high blood pressure, elevated cholesterol, things that can really cripple your cardiovascular health. Okay, so I found, obviously I wasn't in good shape. My resting pulse was pretty high, higher than it should be, and we can get into that in more detail later. But there were a number of markers, both physiologically and mentally, that I found were not good for me. And then all of us, we love to look well, right? So obviously, as you get more trim and more fit, you feel better about yourself, right? And then you tend to do things in that space that are more healthy. You start to make better decisions about a number of things. So it had a huge, wide-ranging implications for me, and I think for anyone that partakes in such a thing. So just to recap, some of the immediate health benefits from dropping that weight were lowering my blood pressure. Hypertension is called the silent killer for many reasons, because you can have a very, very high blood pressure, not know it, all of a sudden have a cardiovascular event that could be deadly, okay? So lower my blood pressure, gave me a better cholesterol profile, which obviously is quite healthy as well too. And again, we briefly touched upon some of the things it does for you mentally. So for me, those were huge, huge impacts as far as, what working out and becoming more fit did for me. So there's some serious ones that can cause death, and there's some more, personal ones, just like, hey, you look better, you feel better, you're getting in that suit, you're doing whatever you do. And you can also then, you become an example for other people. People see that transition or see you living in a certain kind of space. They'll ask you questions. Hey, what are you doing? How are you doing it? And I love to talk about these types of things because they are so important to me. So it touched upon a number of different and extremely important aspects of just daily living and mental health as well.
My brother, again, I want to thank you for coming on with me. I know you're a very busy man.
Yes.
I appreciate the knowledge that you've given everybody as to how they can help themselves maintain or improve their health and quality of life.
Absolutely.
And I just want to say thank you again. For everybody else, I hope you enjoyed this. Until next time, be safe, stay healthy, and get your 30 minutes in.
That's what's up. Thank you, my brother.